Onto the side at the hip region, gluteus medius. Gluteus medius, primarily we'll be doing abduction at the hip, gluteus medius. Just by the side of that, a little bit more anterior, is tensor fasciolata. Tensor fasciolata, a muscle that puts attention onto the fascia on the lateral side of the leg, which is the iliotibial band. Tensor fasciolata will do flexion at the hip, abduction at the hip, and medial rotation at the hip. Tensor fasciolata, flexion at the hip, abduction at the hip, and medial rotation at the hip. Into the groin region, pectineus. Pectineus. So it comes from the pubis, and then it goes down onto the femur. It will do flexion at the hip and adduction. Flexion and adduction at the hip. Pectineus. This is what pectineus looks like when some of the other muscles are being cut away so we can see underneath them. So pectineus. From the pubis to the posterior part of the femur, flexion at the hip and adduction at the hip. Pectineus. Sartorius. Sartorius is the longest muscle that we have, and it starts from the ilium and goes all the way down to the tibia. It does not attach to the femur. From the ilium to the tibia. It will do lateral rotation at the hip, flexion at the hip, and flexion at the knee. So its action makes a figure 4, which we'll show you on a live model later. Sartorius, the longest muscle that we have. Rectus femoris, rectus femoris, part of the quadriceps muscles, and again this does not attach to the femur. It comes from the ilium, 2 attachment points on the ilium, and comes all the way down to the tibia, tibial tuberosity. Rectus femoris. Flexion at the hip and extension at the knee. Rectus femoris, rectus femoris. The vastus muscles, the remainder of the quadriceps group, so rectus femoris is one, and in this particular section, rectus femoris has been cut away to allow us to see the underneath muscles, the deeper muscles. Vastus medialis. Vastus medialis is on the inside. Vastus lateralis. So vastus lateralis is on the outside. In between the two is vastus intermedius. Vastus medialis. Vastus lateralis. Vastus intermedius. And covering that is rectus femoris. So if we have a look on the other side where all the muscles are complete, rectus femoris, vastus intermedius, which looks quite small on that side, which I think looks like a teardrop, and vastus lateralis onto the outside. Covering up vastus intermedius is rectus femoris, rectus femoris. Vastus medialis, vastus intermedius, and vastus lateralis. As a group, they will do extension at the knee. They will straighten the leg out when the knee is bent. We go back up to the hip again, so the anterior, the front of the hip. We have tensor fasciolata, sartorius, and rectus femoris, rectus femoris. And inside there we have pectineus. Underneath there we have iliacus and psoas as well. Tensor fasciolata, sartorius, rectus femoris, rectus femoris. The most medial muscle of the thigh is gracilis. So it comes from the pubis and it goes all the way down onto the tibia. It does not attach to the femur. From the pubis, and then comes all the way down onto the tibia. Gracilis will do adduction at the hip and flexion at the knee. Gracilis, the most medial muscle of the thigh. On the inside, the medial side of the thigh, we have the adductor group of muscles, adductor longus, adductor brevis, and then underneath all of that is adductor magnus. The adductor group of muscles, adductor longus, adductor brevis, adductor magnus. If we go on to the other side, that is adductor longus, same muscle there. Adductor brevis is just a small one underneath there. And then adductor magnus is actually a huge muscle. It's underneath all of these areas. Adductor longus, adductor brevis, and adductor magnus is the most medial bone of the lower leg. Tibialis anterior is just lateral to that, and it's in the top half, the proximal half. And the actual tendon crosses over and comes onto the medial side. Tibialis anterior, so that will do dorsiflexion. It will bring the foot up towards the knee, up towards the head. And it will also turn the foot in, so the big toe comes up towards the nose, inversion. Tibialis anterior, dorsiflexion, lifting the foot up, and then turn the foot in, inversion. If you come just a little bit further around to the side, there is the peroneus muscles. So there is peroneus longus, peroneus brevis, and there's also a peroneus tertius as well, a third one. These are very much involved in rolling the ankles. So when there's been an injury, rolling the ankles, these will be sore. Peroneus longus, peroneus brevis, and tertius as well. In some cases, people now are calling this fibularis. Perone means fibula. So fibularis is not a new muscle, it's just a different name that's given to the same muscle. Peroneus or fibularis longus, peroneus or fibularis brevis, and then peroneus fibularis tertius. They will do eversion. They will twist the foot so the little toe comes up towards the ear.